Good morning. I am Dr. P.A. Muhammed Kunju, Professor and Head, Department of Pediatric Neurology, Medical College, Trivandrum. So, we are going to discuss a general aspect of epilepsy. I will be focusing mainly on childhood epilepsy aspect. Epilepsy can be considered as a burst of a bomb. Usually we know that an electrical activity comes from the brain in an orderly fashion. When the electrical activity is coming in a sudden and disorderly fashion, we call it as an epilepsy. And epilepsy can occur in children as well as in adults. This is a video of a seizure occurring in newborn. Epilepsy can occur in newborn, as we can see in this video. Similarly, it can occur even in an elderly person. And this is what is called as an adversive seizure or a complex partial seizure, in which you can see that the patient is raising the hand as well as turning the head to opposite side with a chewing movement. Also can be seen at the end of the epilepsy. So there are a lot of misconceptions about epilepsy also, and many people use a lot of local treatment also rather than going for a scientific treatment. So nowadays, because of the advent of scientific medicine, there are a lot of better aspects in the management of epilepsy. So what are the steps in the management of epilepsy? Usually we will be trying to identify whether the epilepsy is a true seizure or not. So that means whether it is a true seizure or is it a seizure or a seizure-like episode. Usually we say that all that shakes is not epilepsy, and all the epilepsies are not associated with shakes. And that means we have to identify whether it is a true seizure or not. In this, we can see that there are a lot of bystanders looking around the patient, and the patient is showing some sort of thrashing movement, turning his head, closing his eyes in a willful manner. So that means here from the very appearance you can see that there are a lot of people crowding around. So when the people are there, he is showing up, and this is what is called as a pseudo seizure or a psychogenic seizure, or it can be considered as a hysterical conversion reaction. This again is just an abnormal movement occurring on a face. This also cannot be considered as a fit. This is just a tics. Next step is in identifying the type of seizure. So this is the drawing of a brain. You can see how the brain is being drawn, and the front part of the brain is the frontal lobe, the middle part is the parietal lobe, the lower part is the posteriorly it is the occipital lobe, and the lower part is the temporal lobe. Depending upon the brain activity or the electrical activity coming from one region, we will get different type of seizure. For example, if it is occurring from the front part, then that is called as the frontal lobe epilepsy. If it is occurring from the parietal lobe, the manifestation will be more of sensory in origin. And if the seizures are occurring from the temporal lobe, that is TL, then we will get most of the time psychic manifestations or mental manifestations. And if it is occurring from the back of the brain, that is from the occipital cortex, then usually the epilepsy will be associated with visual manifestations like visual aura or flashes of light, blackening in front of the eyes, etc. So this is again another picture showing the different activities of the brain depending upon the type of origin. For example, from the frontal region means it will be more of motor activity or as a sudden movement, sudden jerking. Or if it is in the parietal lobe, you can see that the sensory abnormalities are there. Or from the temporal lobe, psychic manifestations or speech arrest, etc. We can see that the electrical activity is occurring from a small part of the brain, we call it as a partial epilepsy or a focal epilepsy. When it is occurring from, this is the partial epilepsy, where usually the movement will occur in one side of the body or one side of the face, or the partial seizure, that means from the one part of the brain it can spread to the central part of the brain, and then again it can spread to different part of the brain. That is called as partial seizure becoming secondarily generalized. And so this is a generalized seizure. You can see that the patient is hyperventilating, and at the end of the hyperventilation, the patient's consciousness will be lost. That means a child who is continuously talking will stop talking for some time and then resume talking, or a child who is writing for some time stops writing and resumes writing. And this sort of attack is called as absence epilepsy. That means the child is absenting from the activity. So that is called as an absence epilepsy. And this child, again, you can see that he is taking a deep breath, and at the end of the breath you just watch, he is just taking a deep breath. Usually the clinicians, the doctors, will try to bring about this attack. Then after that you can see that he has lost the consciousness. He is just squeezing the hand. So that is what is called as automatism. So this is a complex partial seizure where he has lost the consciousness. Along with that he is doing some sort of motor activity. That is called as automatism. So when a loss of consciousness with automatism is there, this type of epilepsy is called as complex partial epilepsy. So in generalized epilepsy, as in this picture, you can see that the brain activity, the electrical activity is coming from the central part of the brain and then spreads to the other part of the brain. So that is called as a generalized epilepsy. And usually the EEG that we take, because we take EEG to know the electrical activity inside the brain and see whether it is coming from a generalized manner or it is from a focal area, that is from one specific area of the brain. So we can identify electrical activity whether it is arising from a single part of the brain or from the generalized part by taking an electroencephalogram or EEG. This EEG is just like ECG or electrocardiogram, where we put electrodes over the chest. Instead of chest, in the EEG we keep the electrodes over the head and record the electrical activity. And in this record you are seeing the typical EEG pattern in an absence seizure, that is a 3 per second spike and wave activity. If this activity is seen in EEG with the video that I have shown, then we will make a diagnosis of absence epilepsy. And in a child who is not doing well in a class, or he is not attentive in the class, or if the teacher finds that his notes are incomplete, then this disease must be suspected. And then coming to the generalized epilepsy or the classic grand mal epilepsy or the tonic-clonic seizure, that is what we usually see in a usual situation in a school or in a public places, where you can see that the child will be getting sudden loss of consciousness followed by contraction of the body and then jerking of the body. So that is why it is called as a tonic-clonic convulsion. And this is the one type of epilepsy that occurring in a small child. And you can see that usually partial epilepsies will be occurring from one side of the body, and then so depending upon the area from where the brain is showing the abnormal discharge, we will get different type of partial epilepsies. So here you can see that the child is getting twitching on one side of the face. So this twitching when occurring on one side of the face, we can call that focal motor epilepsy. And usually such children, when we take a scan or something like that, then in the same region we will get an abnormality called as either a tumor or a tubercular lesion or a worm lesion like cysticercosis. So cysticercosis is a type of worm that goes into the brain and it can produce seizure, which is commonly seen in northern part of India. Again, in this you can watch the patient is showing a chewing movement of the face with an abnormal movement in say manipulating in the clothes. Here we can, and an abnormal type of smile. So this is called as a complex partial seizure, which I have discussed earlier. And in such children also, when we take a scan, they will be showing some abnormality in the body. So having discussed whether the epilepsy is a true epilepsy or what is the type of epilepsy, then usually we try to identify an epileptic syndrome. That means in addition to the type of epilepsy that I have discussed, like a partial seizure or a generalized seizure, in children they can have other associated manifestations like mental retardation, difficulty in studying, or if they can have specific abnormalities like weakness of a limb, like that. So when epilepsy associated with other manifestations are there, then we call it as a epileptic syndrome. So identifying an epileptic syndrome is important for starting medicines depending upon the type of epilepsy. For example, if epilepsy is occurring in a very small child with associated mental retardation, then we know that it is going to be a very severe problem. But suppose an epilepsy occurring in a 12-year-old boy during sleep, then we know that it is not a serious disease, so the treatment need not be given in such patients. So that means it can be a severe epileptic syndrome or a very benign epileptic syndrome. So one such epileptic syndrome that may occur in a young boy or a young girl is juvenile myoclonic epilepsy, where the patient will be getting sudden jerks as well as staring spells, especially when it occurs in a 12-year-old girl, which may have a relationship with menstruation. Then it is called as juvenile myoclonic epilepsy. In such children, actually they may have to get treatment continuously for long time. So as I have told you, after we have discussed or identified the type of epilepsy and epileptic syndrome, we usually do an electroencephalogram or EEG. In this we put different electrodes so that we get a record like this, and in the EEG we can identify the area of electrical activity. By that we can identify the type of epilepsy and we will start on treatment. So this is a representation of the EEG, and you can see that by the electrode placement we will be able to identify the areas from which these are the electrodes, and from this you can see the brain and the electrical activity that is arising from different part of the brain. So this is how the electrodes are placed and how it is being recorded. And this is another type of epilepsy that is occurring in a very young infant. You can see that here we are recording the EEG as well as the video of the patient. So this is usually required when a patient's epilepsy cannot be described properly, and we have to identify whether the epilepsy is associated with a definite electrical abnormality. So this is what is called as video EEG recording. So that means we can identify the attack as well as the electrical change. So by identifying this, we will identify the site of origin of the electrical discharge, and in certain children when an epileptic surgery is required, we can identify the type of surgery required by doing this video EEG recording. So after identifying the epileptic syndromes and identifying the type of epilepsy, we can give different type of treatment depending upon the type of epilepsy. Usually there are certain mistakes associated with epilepsy. So when the epilepsy is diagnosed, usually we will give medications, and when you are advised a medicine, as per the doctor's advice, you have to take that medicine regularly. So if you stop the medicine abruptly or suddenly, then the same medicine when given later will not give the direct or a desired result. And in certain type of patients, for example in 25% of cases, even epilepsy may not be always controllable by usual treatment, and in such situations we may have to go for other type of treatment. Then what will you do? when a patient is getting an epilepsy. That means when you are seeing a seizure, the first aid has to be given. See, for example, the first step is to keep the patient in a well-placed area so that there won't be any injury occurring. Second, if there is any tight clothing is there, you remove that clothes. And third, you have to keep the patient on sideways, because usually when epilepsy is occurring, there can be increased salivation as well as vomiting. So if it goes into the lungs, then the patient may choke and may die. So in order to avoid that, you keep the patient in a side-lying position. And finally, you should not be, earlier people used to put some spoon or some wooden material into the mouth. Actually, you should not be putting anything into the mouth, because when epilepsy occurs, in the first phase itself, if the patient is going to bite the tongue, the biting of the tongue will occur. So after the epilepsy is continuing, if you are pushing something into the mouth, actually instead of reducing the injury, you will be producing more injury to the mouth, as well as even the teeth also may fall off. And similarly, you should not be restraining the patient also, because you should not restrain the patient. And always you look for any ID. For example, some patients may be having some identification which suggests that they are having an epilepsy. And as I have told you, you should not hold down the patient, because holding down or restraining the patient will make injury to the body parts as well as fractures to the legs bone or the hand bones. And when the patient's seizure ends, you can offer the patient, offer the help. And when will you call the help of a doctor? Suppose the fits is not stopping for more than 5 minutes or continuing for more than 5 minutes, or if the patient is getting recurrent or repeated epilepsies, or if the patient gives a history that he has stopped the medicine which he was taking earlier. In such situations, you must call an emergency vehicle and transport the patient to the hospital. If the patient has had only one epilepsy or one fit, then there is no urgency in taking the patient to a hospital. But as soon as he gets a recurrence of seizure, or if patient was not taking medicines regularly, then the patient must be taken to the hospital. So there is another situation called as continuous fit occurring. As I have told you, if the fit is continuing for more than 5 minutes, or if the fit is more than 30 minutes, then we call it as a status epileptic. In such situations, it is an emergency and you must take the patient to the casualty, and the patient may be admitted in an intensive care unit by the doctors. And always it is better to know about the drugs also. When your doctor prescribes a medicine to you, you always ask details about the medicine, how it is to be taken, how many times it has to be taken, how long it has to be taken. That is very, very important, because usually when we treat a patient with epilepsy, minimum period may be 2 years, or for some patients we may give 3 years, or in some patients you may have to give a lifelong treatment. So if it is so that means you have to ask about the duration of the treatment from the doctor, and you should not be stopping the medicines on your own. When you are taking the medicine, some problems occurs, immediately you must contact the doctor and you must take a decision depending upon the doctor's advice only. And sometimes you may have to ask for medicines which are not available in India. So in such situations you may have to seek the help of some voluntary organization, especially in certain type of epilepsies. But one advantage in these years is that most of the medicines are available in India except 1 or 2 medicines. So that means by medications we can control almost 80% of epilepsy. In certain situations when the drugs are not available, then a lot of medications are available, and with all these medicines we can control epilepsy in up to 85% of patients. The rest of the patients, that means 15%, can be helped by epilepsy surgery or by newer modalities of treatment, or treatment like vagus nerve stimulation. So these type of stimulations also will help in the management of epilepsy. So by modifying their day-to-day habits, getting good sleep. That means going to sleep in a regular manner, taking food correctly, and reducing stress and anxiety, and going for other types of treatment. I think we will be able to control the epilepsy in a better manner. So even if there is an epilepsy, there is no problem, no point in panicking. There is help, and you can seek the help from the doctors, and you must follow the advice of the patient. You must follow the advice of the treating doctor. And in very rarely only the epilepsy cannot be controlled. Even in such situations, as I have told you, we will go for a video EEG monitoring. We will find out the etiology or the cause inside the brain, and by seeking help for epilepsy surgery or for advanced treatment, other 10% of patients also can be cured. That means epilepsy is a fully treatable condition, and only problem is you have to identify the cause of it, and you tackle the cause. You have to take the medicine regularly. You have to have a steady life with a regular sleep habit, regular food habit, and regular recreational activities. And in this way, you can control the epilepsy. Thank you.